6,000 women in South Africa lose their lives to cervical cancer each year, with over 10,000 new cases reported annually. To talk to us about that, we're joined by Dr. Tumelo Moyaba, a clinical oncologist at the Limpopo Oncology Clinic. Dr. Moyaba, good evening. Thank you so much for your time. Really do appreciate it. Well, cervical cancer is often described as preventable. Talk to us through that, through what means, perhaps clinical and non-clinical. In what ways is it preventable?
Cervical cancer is actually now a cancer for low to middle income countries, and we're seeing it mainly in countries that have not developed an HPV vaccination program. In South Africa, our HPV vaccination program is underway, wherein the government has introduced vaccination among young kids, so that by the time that children turn 12 have been fully vaccinated for HPV. Now, the reason why that is important is 80 to 90% of cervical cancer cases are actually as a result from a virus called human papillomavirus. And that human papillomavirus has got different genotypes, and the common ones are HPV 16 and 18. Now, it is found in Australia and other developed countries that should you vaccinate women for HPV 16 and 18, you are able to prevent 70% of the HPV-associated cancers. That does not only extend only to cervical cancer, but to cancers of the anogenital, oropharynx, and as well penile cancers in men.
Yeah. What has been the uptake of the HPV vaccine in South Africa?
I think the uptake, the program is newly launched compared to our competitors, for example, in Australia and America, wherein the incidences of cervical cancer now are extremely low, because we find that 80% of the cases of cervical cancer actually present in sub-Saharan Africa, wherein the highest incidence are in Swaziland. So the uptake and the program in South Africa is still new. There's a gross uptake, and I think what we need is platforms like these, wherein we educate the country and the people about the importance of vaccinating for HPV.
Yeah. Given that we have a national program now that's relatively new, do we have a chronic under-vaccination problem in South Africa when it comes to HPV, and which demographics are most vulnerable to that?
So currently the program is aimed at young girls, and it is thought that you vaccinate the girls, generally you then develop herd immunity for the rest of the society. So the communities that are at most risk would be as well your HIV positive patients. Now, HPV is highly associated with HIV infections, and you tend to see a higher incidence of HPV associated cancer, cervical cancer included, and penile cancer in men. So you tend to see it in those populations. Now, that is important because treatment for cervical cancer is quite effective, where in patients that are diagnosed in stages between 1 to 3, most can be cured. However, it is the access to resource that becomes a problem. Because of such a high incidence, we do not have enough capacity in with regards to human resources. That includes oncologists, oncology trained nurses, and as well the resources. So the resources that provinces and the people require include radiotherapy, it includes chemotherapy, and we've seen as well with certain provinces having a huge backlog. And for patients that are diagnosed even earlier, that require gynecologist or gyne-oncologist to offer radical surgery to actually remove the cancers.
Yeah.
So it is actually better to prevent it compared to treatment, particularly looking at how the continent and South Africa is severely under-resourced with regards to health facilities.
Yeah, certainly. I mean, prevention always is better. But what is the success rate of a treatment for those who have been diagnosed with it in South Africa by and large? And how much of that is attributed towards early detection?
So currently, the two most common cancers in females in South Africa and Africa is actually breast cancer and cervical cancer. Now, breast cancer has got a higher incidence but compared to cervical cancer, it's got a lower incidence, wherein the incidence of cancers or cervical cancer in women is around 17.9%. That is the incidence, compared to breast cancer, which is 25%. But as a leading cause of death, cervical cancer in 2022 data was higher. Now, that is purely because of access. The main required treatments or treatment modalities for cervical cancer are radiotherapy and surgical operations, wherein it is quite common knowledge that access to surgical facilities in South Africa, particularly in the state, tend to be have a huge backlog, and access to radiotherapy centers also has an even bigger backlog, wherein certain provinces, for example, Mpumalanga, actually do not actually have a radiotherapy center in the state sector to service the public patients. And that is a common trend as well amongst other provinces. KZN, Johannesburg, you find that there is a big backlog, but there is a move which is highly encouraged and highly commended, wherein there's public-private partnerships to alleviate those backlogs.
Yeah, and just lastly, is the HPV vaccine a once-off or a recurring vaccine?
The HPV vaccine is 2 injections. There's one injection, and then there's a booster which is given 6 months later, and that should provide immunity. It is encouraged that vaccination starts before any person engages in any sexual activity, and hence the vaccinations are starting from an early age, 10 to 12 years.
Yeah, thank you so much for that. Really do appreciate it. That is Dr. Tumelo Moyaba, an oncologist at the Limpopo Oncology Clinic.